What is the mechanism of Pitta Kapha disease? How to understand the pathological events in the Pitta Kapha dominant disease conditions? This is the topic of discussion in today's video. Dear ANA community members, press the like button and spread this particular video to maximum number of true Nidana learners so that you can have the huge learning out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. When you think about the Pitta Kapha diseases, these are the spectrum of the diseases or the dysfunctions wherein we are going to observe the abnormal increase or a vitiation of Pitta and Kapha bioenergies in the body. When you think about the pathogenesis, in the sense the persons they will be having the exposure to etiological factors which will lead to the vitiation of Pitta as well as Kapha dosha. So here that is considered to be the Nidana, which are considered to be Pittam Katvam Latikshnoshna Patukroda Vidahibihi Sharanmadhyana Ratriyarth Vidaha Samayeshu Cha. If the person is exposed to these etiological factors, there will be Pitta dosha vitiation. Whereas Swadvamla Lavanasnigdha Gurvabhishyandi Sheetalaihi Asya Swapna Sukha Jirna Diva Swapnati Brahmanehi Prachardana Bhuktamatra Vasantayoho Purhane Puraratre Shleshma. These are the Nidana. So they are going to be responsible for the vitiation of the Kapha dosha in the body. When the person is exposed to Pitta or Kapha dosha, Pitta and Kapha dosha vitiation at a particular time period, there may be the possibility of the dual dosha vitiation, that is Pitta and Kapha dosha vitiation. Though it is very easy to say, but very difficult to implement and understand. Still, there is the attempt is being made to understand this particular pathogenesis of Pitta Kapha dominant diseases. When you think about the Pancha Mahabhuta point of view, so there will be Pitta is considered to be having the dominance of Tejo Mahabhuta and Kapha dosha is having the dominance of Prithvi and Ap Mahabhuta. So that means when the person is exposed to the etiological factors which are responsible for the increase of Prithvi, Up and Tejo Mahabhuta, there will be the vitiation of Pitta and Kapha dosha take place. Suppose if you are considering the proportions of Prithvi, Up and Tejo Mahabhuta as equal proportion in a Nidana, so that means all these they will be having 33.3% as such. When you consider this as such, so there will be the 2x amount of Kapha dosha vitiation takes place and 1x amount of Pitta dosha vitiation is going to take place. But when you think about the Nidana, so this particular what you say that the Pancha Mahabhuta exposure will not be equal to 33% in always. In some of the occasions, Prithvi Mahabhuta may be up to 10 or 20% exposure may be there. And in some of the other occasions, there will be the Tejo Mahabhuta, some 60% may be there. And Up Mahabhutas, for example, that may be up to 80% may be there. In that particular situation, we are going to observe the dual dosha vitiation. Why so this particular assessment is difficult? Because the person is going to consume the food substances, they may vary. The person is going to consume one morsel of the food substance, there may be a possibility of different dosha vitiation. Another morsel, different dosha vitiation. Third morsel, different dosha vitiation. So in that way, the proportion of dosha vitiation is going to differ in each and every individual depending upon the nature of a etiological factor exposure. When you think about Shadrasa point of view, whenever the person is going to consume the Katu rasa substances, Amla, Lavana rasa substances and Madhura rasa substances, there may be the possibility of dual dosha vitiation. For example, Katu and Madhura Rasa Ahara Sevana. So there will be the possibility of a Vata Pitta dosha vitiation or Kapha dosha vitiation is going to take place. Suppose if the person is going to consume Amla, Lavana and Madhura Rasa substances in equal proportion, Kapha dosha vitiation is going to take place maximum. To a lesser extent, Pitta dosha vitiation is going to take place. Katu, Lavana Rasa substances as such, there may be the possibility of a Teja Mahabhuta dominance at a particular time period, whereas the Vata as well as the Kapha dosha vitiation may be going to take place little bit lesser extent. In that way, Shadrasa point of view, that there may be a possibility of Pitta and Kapha dosha vitiation. As far as the Guna point of view is concerned, this is an example of the food preparation wherein there may be a possibility of the what do you say, that the Madhura Rasa plus Amla Rasa dominance at a particular time period. In that particular situation, the Pitta dosha, that is, we know that that will be having the gunas Pittam Sasnehati Shnushla Visram Saram Dravam. Whereas the Kapha dosha is having Snigdho Shito Gurur Mandash Lakshno Mrasna Stiraha Kapha. These are the different qualities. When you think about the qualities which are similar to Pitta and Kapha, that is Snigdha. When the person is exposed to Snigdha qualities, substances, there may be a possibility of the dual dosha vitiation. That is what is considered to be the Pitta as well as Kapha dosha. But here, the impact may be observed not only in the alimentary canal, it can be seen in any part of the body. As far as Snehana is concerned, Snigdha Guna is concerned, suppose if the person is exposed to Snehapana, so that means the Snigdha Guna increase, we are going to observe in the alimentary canal. Abhyanga, Snigdha Guna increase may be seen in the Tvak region. Anuvasana Basti, Snigdha Guna increase is seen in large intestine. Snigdhanasya, wherein the Snigdha Guna increase is observed in the head and neck region and nose as such. Food prepared by Sarshapataila. So here the Kapha dosha as well as Pitta dosha vitiation may be observed in the alimentary canal. Tarpana to the eyes. Snigdha Guna increase is seen in eyes, and Gandusha, Snigdha Guna increase is observed in mouth, and Katibasti, Snigdha Guna increase is seen in the back region. So like that, the Snehana exposure will be having the impact on the different body parts. Depending upon that, there may be a possibility of Pitta as well as Kapha dosha increase may be seen. Virya Vipaka point of view. When the person is consuming the Katu and Madhura Rasa Ahara, Katu and Madhura Vipaka, as such, we are going to observe the Pitta and Kapha dosha increase in the body. Virya point of view, Shita Virya substances as well as Ushta Virya substances exposure. Depending upon that, the proportion of Shita and Ushna Virya, we are going to observe the abnormal increase of Pitta and Kapha dosha. Suppose Ushna Virya is more than Shita Virya, we are going to observe the Pitta dosha increase in the body. If Shita Virya is more than Ushna Virya, then we are going to observe the abnormal increase of Kapha as well as Pitta in that particular individual. Prakopa Karma point of view. So here, if it is seen in the lower limb as such, there is a small pustule, we are going to say there may be a possibility of Pitta as well as Kapha dosha increase in the lower limb, we are going to predict. It is mentioned that Pittasya daha ragoshma pakitaha Svedah kledah smrutihi kotha sadanam murchanam madah Katugamla vraso varnah panduraruna varjitah. Whereas Shleshmanah sneha kaఠిన్య kandushittatva gauravam बन्धोपलेपस्तैमित्य शोफापक्त्येन निद्रताः वर्णः श्वेतो रसौ स्वादु लवणौ चिरकारिता. The paka in this particular situation that may indicate the pitta dosha increase, and shofa that may indicate abnormal increase of kapha dosha in the body. So like that we can able to predict the manifestation of Pitta Kapha dominant disease. As far as clinical presentation is concerned, here is an example. 30-year-old female presented with yellowish discoloration of the eyes, skin, etc. associated with ascites. So here, the presence of the yellowish discoloration in the skin, sclera, etc. that may indicate Pitta dosha dominance, and the presence of ascites that may indicate Kapha dosha dominance. Hence, we are going to say that there may be a possibility of Pitta Kapha dominant disease. Further, as far as clinical features are concerned, it is being mentioned that Pitta Vinmutra Netratva Kshutra Dahalma Nidradaha Pittam Shleshmagni Sadana Prase Kalasya Gaurapam Shvaitya Shaitya Shatangatvam Shwasa Kasati Nidrata. If you are observing any of these lakshana in an individual, then we are going to say the person is having Pitta Kapha dosha dominance at that particular time period. As far as sthana is concerned, or locations of these dosha are concerned, Pitta dosha is considered to be Nabhirama Shayosvedo Lasika Rudhiram Rasa Drik Sparshanam Cha Pittasya. Whereas the Kapha dosha, Lasthana, that is considered Urahakanta Shiraha Kloma Parvani Ama Shayorasaha Medo Kranam Jajihwaja. You need to inquire about the specific coronal dysfunction. For example, the Navi, if there is any kind of the disturbance activities related to Navi, has to be inquired with the patient. Amashaya, any of the disturbed function related to Amashaya has to be inquired. Sweda, sweat, any kind of the sweating disturbances or the eyes, skin, etc. All these different organs should be inquired related to the abnormal activities related to that. Based on it, we are going to say there may be a possibility of a Pitta or Kapha dosha increase in the body. As far as the Udbhavasthana is concerned, depending upon the manifestation of the symptom, we are going to say that there may be a possibility of a dysfunction of either Urdhva Amashaya or Adho Amashaya. When the person is having the Kapha dosha dysfunction, most probably we are going to say that there may be a possibility of affliction of Urdhva Amashaya. If there is the Pitta dosha dominance is being observed, then we are going to predict there may be a possibility of Adho Amashaya as the possible Udbhavasthana in the manifestation of disease, as far as Nidana point of view. So, the example of Dahi Vada, let us take. If a person is going to take one Dahi Vada at around 9 o'clock, then we are going to say that there may be a possibility of a Pitta as well as Kapha dosha increase. If the person is going to consume 3 plates of Dahi Vada at around 11 o'clock, then we are going to observe Pitta dosha increase and Kapha dosha increase to a lesser extent. If the person is going to consume 5 plates of Dahi Vada at around 8 p.m. in the month of May, then we are going to predict there may be a possibility of abnormally increased Pitta dosha vitiation, and to a much lesser extent Kapha dosha increase may be observed. As far as Bala Samprapti point of view, we have to inquire Pitta Vinmutra Netratva Kshutrudalpa Nidrataha Pittam. We have to inquire all these lakshana related to Pitta dosha increase. Whereas Kapha dosha increase, Shleshmagne Sadana Prase Kalasya Gaurubam, Shvaitya Shaitya Shatangatvam Shwasa Kasati Nidrata. We have to inquire each and every lakshana which may indicate the abnormal increase of Pitta and Kapha dosha in the body. By seeing these lakshana in the patient, we are going to predict the possible affliction of a Pitta and Kapha dosha increase. As far as Nidana point of view, the same example let us take. Then, the source of the entry of the pathogen is through oral cavity. And here, depending upon the quantity of the Dahi Vada, we are going to say that the possibility of the exposure to Shita Guna and Snigdha Guna, we may suggest that, we may suspect, which may indicate the Pitta as well as Kapha dosha increase in the body. To sum up the Pitta Kapha dominant diseases pathological understanding, we have to inquire about the following factors. For example, whether the person is exposed to Tejas up and Prithvi Mahabhuta dominance Nidana in the body. One has to inquire about the exposure to Katu, Amla, Lavana and Madhurasa substances intake. We have to inquire about the exposure to Nidana which increases Nigdha Guna in the body. We have to inquire regarding the exposure to the Nidana which are having the Shita and Ushna Virya substances in the body, or the Madhura and Amla Vipaka. As such, we have to inquire that. We have to observe the Kupita karma of Pitta and Kapha dosha. Pittasya daha ragushma pakitaha swedah kledah suttehi kotah sadanam murchanam madaha katukamlam rasau varnah kandurarana varjitaha. We have to inquire about the Vruddha Lakshana of a Pitta and Kapha dosha. That is Pita Vinmutra Netratva Kshutrdaha Panidrataha Pittam. Shleshmagni Sadana Prase Kalasya Gauravam Shwaitya Shaitya Shatangatvam Shwasa Kasati Nidrata. We have to inquire about these. And we have to observe the Udbhavastha as Amashaya or Adho Amashaya affliction is being seen or not, that has to be known. We have to inquire the dysfunctions related to the different sthanas of Pitta and Kapha dosha. That is Nabhirama Shayo Svedo Rasikardiram Rasaha Drik Sparshanam Cha Pittasya Nabhiratra Visheshatah Puraha Kanta Shiraha Kloma Parvani Ama Shayo Rasaha Medo Kranam Cha Jikvacha Kapasya Sutaram Ura. We have to analyze the Samprapti of Pitta and Kapha dosha dysfunction has to be known. Then we have to know about the Nidanas of Pitta and Kapha dosha dysfunction has to be analyzed. Katwamlo Shukdahitya Navana Krodho Pavasa Tapastri Sampark Dilatasi Dadisura Shuktara Naladivi Bhukti Jirede Bhojane Sharadi Grishmisiti Pranina Madhyani Tatardrat Pittam Prakovam Raje. These are the Nidana related to Pitta dosha. Regarding the Kapha dosha, regarding the Guru Madhura Satisnigda Duktekshu Vaksha Dravadati Dina Nidra Pupa Satush Prapurehi Tuhinapatana Kale Shleshmana Samprakopa Prabodhi Devasado Puttamatre Vasante. These are the Kapha dosha Nidanas as such. These are the things that has to be analyzed when we are going to decode the Pitta Kapha dominant diseases and its pathogenesis. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that I do have in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. That's all for today. Something more in the next video. Thank you.